Now let us see the clinical manifestation. So clinical manifestation of ASD. Okay, so that is a first and foremost is there will be dyspnea, tachycardia, okay, recurrent respiratory tract infection. So this dyspnea, tachycardia, tachypnea, okay, and recurrent respiratory tract infection are because of pulmonary edema. Okay, so one more is tachypnea. So dyspnea means difficulty in breathing, tachypnea means tachycardia means increased heart rate more than 100, and recurrent respiratory tract infection because of pulmonary edema, and tachypnea is increased heart rate more than 24 per minute. Okay, and apart from this, there will be failure to thrive. So the child will not have optimum achievement of height and weight. Okay, and apart from this, what you can see is there will be one more point that we need to know is shortness of breath. Breathe. Okay, and next one is difficulty in feeding. So this difficulty in feeding is because of dyspnea. Okay, it is very difficult to feed the baby. Okay, so these are the clinical manifestation of atrial septal defect. Now let us see the diagnostic evaluation. Okay, so how to diagnose this condition, that is diagnostic evaluation, how to diagnose the condition. Okay, first and foremost is history collection. Okay, so history should be collected from the mother, that how does the baby is delivered, whether the baby is delivered normal vaginal delivery, or whether there is any whether there is any difficulty in progress of labor, okay, or birth asphyxia, okay, whether the mother is consuming any alcohol during pregnancy, okay, alcohol during pregnancy, okay, birth asphyxia, we can collect birth asphyxia history, okay, any teratogenic drugs, okay, teratogenic drugs like thalidomide, or a teratogenic infection like a rubella infection during the pregnancy. So these history can be collected from the mother. Okay, next what else we can do is, that is a physical examination. So when you do a physical examination, what you will come to know, so because of the atrial septal defect and shunting of blood from left atrium to the right atrium, there is a murmur called systolic murmur, ejection systolic murmur will be there. Apart from this, failure to thrive, there is no proper height and weight achievement. Okay, and next one is, what will be there? There will be dyspnea, tachypnea, tachycardia. So all these signs and symptoms we can make on physical examination. Okay, and next one is, we can also do cardiac catheterization. So third one is cardiac catheterization. So when you do a cardiac catheterization, so usually we do a left-sided heart catheterization. Okay, so left-sided heart catheterization means, what we do here, so this is the heart. Okay, so here there is a defect in ASD. So left-sided heart catheterization means what? The catheter is inserted through the artery. Okay, so that is artery, any radial artery. So from the artery, the catheter will enter into the aorta, arc of aorta, then descending aorta, and then catheter is progressed from left ventricle to the left atrium. Okay, so when the catheter, as soon as the catheter enter into the left ventricle, so the pressure, as this catheter is pressure sensitive, tipped transducer will be there. There will be pressure sensitive transducer will be there at the tip of the catheter, so that will measure the pressure in the left ventricle. So the pressure in the left ventricle is relatively less. It is because of a shunting of blood from left atrium to the right atrium. Okay, and as the catheter is moved, okay, as the catheter is proceeded from left ventricle to the left atrium, and when we inject the dye in the left atrium, so by this we can see there is a shunting of dye from left to the right. Okay, so the many X-ray film will be taken. Okay, that is under the help of a fluoroscopy, and by the fluoroscopy we can come to know that there is a shunting of dye from left atrium to the right atrium, which confirm the atrial septal defect. Okay. So this is the cardiac catheterization. So the catheter is inserted from atrium. So catheter is inserted from the artery to the aorta, aorta to the descending aorta, and finally the catheter will enter into the left ventricle. And pressure in the left ventricle is measured, which will be less because of shunting of blood from left side to the right side. And again the catheter is progressed to the left atrium, and dye is injected in the left atrium, and are followed by a dye injection. The many with the help of fluoroscopy, the film is be taken so that the dye movement is visualized. Okay, so there will be movement of dye from left atrium to, or shunting of dye from left atrium to the right atrium. So this will confirm the atrial septal defect. So apart from this, what else will be there? So 2D echo can be done. Okay, 2D echo. So when you do a 2D echo, what you can see, there is a, because of shunting of blood from left to right. Okay, so and there will be decrease ejection fraction. Okay, so there will be decrease ejection fraction, as there is shunting of blood from left side of the heart to the right side. So there is a decrease cardiac output and decreased stroke volume. So that can be evidenced by 2D echo. Okay. So next we shall see management of a atrial septal defect. So the last part is management. Okay. So first one is medical management. So in medical management, see here, if the defect is very small, then there is a usually the child is asymptomatic. There is no symptom at all. Okay. But if the structural defect, that is ASD, is larger in size, then there is a more shunting of blood and significant signs and symptoms you can see. Okay. For mild ASD, there is a wait and watch treatment is there. There is nothing structural surgery and anything nothing more is given. Okay. Wait and watch. If the defect is more, then we can have a treatment for that. Okay. So now what else will be there, that we will see. So first one is correction of anemia. Okay. So correction of anemia. See here, correction of iron deficiency anemia is very important here, because if the child is suffering from iron deficiency anemia along with the atrial septal defect, we need to correct the anemia. If you don't correct the anemia, then the child will easily develop the congestive cardiac failure. So that is why it is very important that the anemia should be corrected when it is associated with the congenital heart disease. Okay, how we can correct it? By supplementation of iron rich. Okay, by supplementation of iron rich diet to the mother. Okay, and to the child when it is able to take its food. Okay, so that is jaggery, beetroot, okay, groundnut, green leafy vegetables, okay, fruits, egg, meat. So all these diet are included for correction of anemia. Okay, if the mother is suffering from severe anemia or the child is suffering from severe anemia, so iron tablet can be given. Okay, and apart from that, blood transfusion to the mother can be also be done if there is a severe anemia, that is a HB is less than like 8 gram per deciliter. Okay, next one is, apart from this, there is a treatment of, second one is treatment of lower respiratory tract infection. Okay, so as I said in the pathophysiology that the ASD will leads to development of pulmonary edema, and pulmonary edema will give rise to treatment of lower respiratory tract. Pulmonary edema can result in development of lower respiratory tract infection. Okay, so because of this, we have to treat the lower respiratory tract infection. So how we are going to treat lower respiratory tract infection? So antibiotic Antibiotics based on culture and sensitivity. Okay, then steam inhalation, nebulization. Okay, so these are the way of treating the lower respiratory tract infection. Okay, now let us see the surgical management of atrial septal defect. Okay, surgical management. So in surgical management, there is a first one is closed heart surgery. In this closed heart surgery, the heart is not opened. Okay, so without opening of the heart, the Asd defect is closed. Okay, so in this closed heart surgery, atrial septal occluder placement is done. Okay, here what they do here, atrial septal occluder placement. Okay, placement. So what they do here in this closed atrial septal defect. So defect is present here in the atrial septum. Okay, so what they will do here, they will pass the catheter. Okay, so the by the cardiac catheterization. Okay, with the method of cardiac catheterization, the catheter is passed through the femoral vein to the inferior vena cava, then inferior vena cava to the right atrium. Okay, so once the catheter comes into the right atrium, okay, so then what they will, the tip they will pass through this defect, and there will be an occluder. So that occluder is opened once the tip enter into this one, and the catheter is withdrawn. So that after that what happens, this occluder will completely close this atrial septal defect. Okay, so that is known as atrial septal occluder placement. Okay, so this is done without opening of the heart or without a sternotomy or thoracotomy. So that is why it is known as closed heart surgery. So what they will do in a atrial septal occluder placement, so the catheter is inserted from the through the femoral vein into the vena cava, inferior vena cava, then into the right atrium, and the catheter is progressed or advanced to pass through the atrial septal defect. Then the occluder is opened and it is placed firmly on the atrial septal defect where the defect is present. That will close the atrial septum and then prevent the shunting of blood from left atrium to the right atrium. Okay, and next one is, one more is there, that is open heart surgery. This is a closed heart surgery, and in open heart surgery. Okay, so this is a closed. Next one is open heart surgery. Open heart surgery. So in open heart surgery, when it is not able to, when the surgeon is not able to place the occluder on the defect, okay, and the size of ASD defect is larger in, okay, so in that condition this open heart surgery is done. Okay, so in the open heart surgery it is, okay, the surgical incision is taken on the sternum, and thoracotomy is done, and heart is exposed, heart is opened, and then the child is put on the heart lung machines. Okay, then here where the defect is present, there the patch is applied here. Okay, so there what they will do here, the patch is applied. Okay, so the septal defect is closed with the patch. Okay, so that is Dacron patch they will use. So they will close the patch, and after the closure of the patch, again the patient is removed from the heart lung machine, and the blood flow through the heart is maintained, and the shunting of blood from left atrium to the right atrium is visualized, and there will be no shunting of blood from left atrium to the right atrium. Okay, so this surgery is known as, okay, open heart surgery and direct closure of a defect with the patch. Okay, next one is nursing management. So the last part of this atrial septal defect, that is a nursing management. So in nursing management, what we have to do is close monitoring of, okay, close monitoring of vital signs we have to do. Okay, next is height and weight height and weight measurement. Okay, so height, or you can say length measurement, that has to be done so as to identify whether the baby is having any failure to thrive. Okay, next one is what you can do here. Iron rich nutritious diet we have to advise. Nutritious diet advice we have to do. Okay, then assign activity according to child tolerance. How much is the child tolerate, that much only activity should be assigned. Okay, and next what else are there? Parents, okay, the emotional support should be given. Okay, parents emotional support. Okay, so nurse has to give emotional support to the parents because they are panic because of presence of structural defect, that is a atrial septal defect. After that, advise medication as per administer medication as pediatrician advice. Okay, so this is a management of atrial septal defect. Okay, so this is all about the atrial septal defect. Okay, if you like this video, please press on the like button, and if you like this video lecture, okay, please share to other your friends, and subscribe and press on the bell button. Okay, so thank you very much. So I will come with some more videos on the congenital heart disease in upcoming videos. Okay, thank you very much.